Hello, good evening to every one of you. My name is Alex, and I'm the MC for tonight's webinar. First of all, I would like to thank EVG Network and my upline. Okay, before we begin our webinar, our AV team has muted your mic, okay, to prevent interruption during our meeting. And later on, we will have a Q&A session, and you can enter your question in the chat box, or you can also unmute your mic to ask your question directly. And if you are using mobile phone to view, to maximize your reading experience by zooming in and out to the slide. Okay, today I bet we all share the same concern about one disaster that created chaos across the COVID-19. Okay, do you ever wonder why there are some people more prone to infection and illnesses while others don't? Tonight, okay, we have a speaker to share with us the power of our gifted guardian, that is our immune system, and how to strengthen our immune system with the right way. Let's welcome our speaker, Nicole.
Hello, good evening everyone. I would like to thank EVG Network and my upline for giving me this opportunity to share this preventive science that bring health and longevity to mankind, which is nutritional immunology. I am Nicole. So let me share the slides with you first. So first of all, I would like to introduce Elite Global. Elite Global is a preventive science education and health food company. The company's mission is to share the gift of health and knowledge with the world. And according to research by genetic experts, the human lifespan should be 120 years old. But why do most people live to a mere 70 years old? And if he can live to 80 years old, we call it longevity. And if he can live to 90 years old, we call it a miracle. Medical science is very advanced, but why do increasing number of people are diagnosed with chronic diseases? And these diseases are seen in younger people. And the death certificates usually state the cause of death as various chronic disease such as heart disease, diabetes, kidney disease, cancer, and so on. This is because nowadays we are faced with various health risks, and the first is unhealthy dietary habit. So nowadays, our diet contains a lot of meat, seafood, which has animal hormones, fats and cholesterols, growth hormones, antibiotics, and preservatives. So there are a lot of people who enjoy fried chicken, French fries, burgers, and these are fast food which are very high in calories. Perhaps some people may say that they are vegetarian and it is healthier. However, we are unable to avoid various pesticides and chemicals fertilizers in the crops. And it is also unavoidable that our food contains seasoning, coloring, and preservatives. And this is why the disease that people nowadays get is commonly known as rich man disease. Next is stress. Stress has become an invincible killer. Whether you are a business owner, employee, housewife, or student, there will be a certain level of stress. It will cause the body to secrete toxic hormones called corticosteroids, which will suppress the immune system, increasing the risk of cancer. Many people place all hopes on medication to recover quickly from illness, leading to the overuse of medication. Some people feel that Western's medication has side effects and turn to traditional Chinese medicine, which is TCM. However, as long as it's medicine, there will be serious side effects if used in excess. There are some medicinal herbs that are very toxic. Just a little, there will be side effects. Natural ingredients does not mean that there will be side effects. In fact, a lot of Western medications are extracted from TCM. Let's take a look at free radicals. Why do our body produce free radicals? Every day, we are exposed to UV rays, fried food, air pollution, smoking, and body's metabolism. And this leads to the production of free radicals. So free radicals will interfere with the stability of cells' DNA, which will slow down cells' repair ability and aging of the organs that may lead to cancer. So right now, all eyes are on the global COVID-19 pandemic, talking about viruses. In fact, viruses existed 1,000 years ago because medical science was not advanced at that time. Humankind relied on their immunity to fight it. Despite the advancement of medical science now, people are still faced with various life-threatening viruses, such as coronaviruses and influenza. Some viruses can even cause cancer, for example, nose cancer, cervical cancer, and 80% of the liver cancer are caused by hepatitis B. And lastly is carcinogens. So this is very hard for us to avoid because we are exposed to it every day. Our daily necessities, skincare, cosmetic, hair dyes, detergents, etc. contains various chemical carcinogens. Example, SLS foaming agent, triclosan, fluoride, lead, and mercury can cause cancer. So next, let us take a look at our organs. First is the throat. The picture on the left shows very rosy and clean, and this is a healthy windpipe. And the picture on the right is a very red, swollen, and inflamed windpipe. And this is a picture of our liver, which is magnified 18,000 times by a microscope. The picture on the left is a healthy liver, where you can see more red dots, and the picture on the right shows a hardened liver, which is liver cirrhosis, with white spots seen. The liver performs more than 500 functions, and it is the only organ with no nerve endings, meaning very often no pain or discomfort is experienced with a liver problem. When a person is diagnosed with liver problem, it is often terminal, so we must always take care of our liver. And this is our joint. The picture on the left shows a healthy joint and it looks very smooth. And the above is the cartilage. And the picture on the right shows a condition of rheumatoid arthritis. The joint is already damaged, and some elderly think that arthritis is caused by sleeping on the floor or taking a shower at night. And it is not. Rheumatoid arthritis is an autoimmune disease where immune system malfunction and it cannot distinguish whether enemy cells and body-owned cell. When people with arthritis feel pain, they will usually go for injection or painkiller. But is it possible for the joint to become healthy again? It is impossible because the disease does not happen overnight, rather over an extended period of time. So it will need to take time to properly nourish it with nutrients to repair it. Going for injection and taking medicine for a long period of time will not be able to cure it, and it often brings more serious side effects, which is osteoporosis. So what is osteoporosis? Osteoporosis is there are holes in the bones, and falls can lead to fractures easily. And according to reports, the main cause of 9.6 million osteoporosis cases in the United States is due to the side effect of medication and excessive intake of animal proteins. So no illness does not equal to healthy. Many people have a thinking that if they do not need to eat medicine or lie on the hospital bed, this means that they are healthy. For example, dizziness, headache, constipation, sensitive nose, and even menstrual cramps, etc. These are sub-health conditions. Hence, no illness does not equate to healthy. And these are the signals our body sends us that we need to pay attention to it. From my analysis above, nowadays, we are faced with many health risks, and the research and development of medicine is unable to keep up with the development of diseases. So let us learn how to achieve good health and longevity through this preventive science, nutritional immunology. First, I would like to introduce the founder of nutritional immunology, Dr. Geoffrey Chen. She is the authority in preventive science and a cancer researcher for more than 30 years. Dr. Chen enrolled in Brigham Young University at age 16, obtained PhD in microbiology at age 26, becoming the first batch of immunology experts. She has received several awards and recognition. In 1992, the Martin de la Cruz Award. On March 8, 1996, it was declared Geoffrey Chen's Day in the state of California in the US. In 1997, 10 outstanding young Americans. In 1999, most outstanding Chinese in the world. And in 2016, Asia Pacific Entrepreneurship Award. So Dr. Chen also written several publications, example, Cancer and Nutritional Immunology, nutrition, immunity, and longevity. So what is nutritional immunology? Nutritional immunology is a science that studies the link between nutrition and the immune system. So what is the immune system? The immune system is like the army of a country. There are Navy, Army, and the Air Force to protect the country. Our immune system has several organs which protect us around the clock. The immune system is made up of several organs, including tonsils, lymph node, thymus, spleen, appendix, and bone marrow, and etc. So the best doctor in the world is our immune system. A healthy immune system protects us against diseases, as more than 90% of the diseases are caused by the malfunctioning of the immune system. So with a healthy immune system, our immune system can help us perform three main functions, which is defense, cleanse, and repair. So let's take a look at the first function, the defense function. So on the left side, this is our B cells. Our B cells can produce more than 1 billion different antibodies in one's lifetime to combat viruses, bacteria, and any other types of invaders. B cell also have a memory function. When it encounters the same virus, it will produce the required antibodies to destroy it within 24 hours. And on the right, which most are fearful about, is our cancer cell. The white cell surrounding it is our natural killer cell. And the role of the natural killer cell is to detect and destroy cancer cells. And after destroying them, it will become waste in our body, which must be excreted out of our body through our cleanse function. So our cleanse function, this one on the left, this is a macrophage with claws. They will extend their claws to hook the bacteria, viruses, and toxins and swallow them, whereby they will be excreted out of our body through our phlegm. And Dr. Chen calls it the garbage man of the body. And on the right, this is another macrophage in our blood vessel. The macrophage will move forward and engulf the cholesterol, triglyceride, toxins, and aged blood cells, whereby they will be excreted out of our body through our bowel movement. And last is our repair function. So the one in red is our blood platelets in our body, repairing the damaged tissues and organs in our body. So why do some people won't heal quickly and some heal slower? It all depends on the capability of our repair function. So the link between nutrition, immune system, and health, they are interrelated. And according to researchers, to be healthy, one needs to have a strong immune system. And to have a strong immune system, one needs to have sufficient sleep, moderate exercise, be positive and happy, and correct, pure, and balanced nutrition. So we hear many share about basic nutrients. So what is the difference between basic nutrients and nutritional immunology product? So the example of basic nutrients are carbohydrates, proteins, vitamins, fats, and minerals. And these nutrients are essential for our survival, which we are not lacking today. And nutritional immunology advocates prevention is better than cure. It focuses the research on three disease-fighting nutrients: phytochemical, antioxidants, and polysaccharide, to boost the immune system to fight against disease and achieve longevity. So let's take a look at these disease-fighting nutrients to boost the immune system. So why do we need phytochemical? Because in our daily diet, we consume a lot of meat, seafood, and these are animal-based food that contains cancer-causing hormones. And today's food is particularly delicious with cancer-causing chemicals. In addition, current lifestyle are more stressful, and this will affect the emotion and causes the production of toxic hormones, increasing the risk of cancer. And phytochemical can neutralize these cancer-causing hormones and prevent tumor growth. So why do we need antioxidant? Just now, as I mentioned, we are exposed to UV rays, fried food, air pollution, smoking, and body's metabolism. And this leads to the production of free radicals. So antioxidant can destroy free radicals, help the body to produce collagen, and can delay aging of the organs and prevent cancer. And so why do we need polysaccharide? Because viruses and chemical carcinogens in our daily necessities products are harmful to the human body and even cause cancer. So polysaccharide can enhance the immune function and speed up the destruction of viruses and cancer cells. So after understanding the nutritional immunology, we will find that most of these diseases can be prevented as long as you follow the way to health and longevity. So by having sufficient sleep and rest, regular and moderate exercise, maintaining a stable emotion, like by staying positive and happy, and include a healthy diet which in pure, correct, well-balanced nutrients. I believe if everyone practices the way to health and longevity, everyone can realize the dream of longevity. Even if we do not live to 120 years old, we can still at least live to 100 years old. So the above is my sharing. I wish you all good health and happiness. Thank you.
Okay, thank you, Nicole, for your great sharing on nutritional immunology. I believe that Nicole's sharing has raised our awareness towards importance of our immune system. And by applying the science of nutritional immunology, we can assure greater health and longevity. Now, let's begin our main topic for tonight's webinar, the world number one killer, cardiovascular disease. According to World Health Organization, cardiovascular disease are the leading cause of death globally, taking an estimated 17.9 million of lives each year. Despite our medical advancement, still cardiovascular disease are on the rise from year to year. In order to prevent cardiovascular disease, we must have greater understanding of cardiovascular disease. Tonight, we have a speaker who would like to share her deepest knowledge on this topic. Let's welcome Jia.
Hello, good evening, everyone. So firstly, I would like to thank EDG Network as well as my upline. So I'm Jia. So today I'll be sharing on how to prevent cardiovascular disease. So when we hear about cardiovascular disease, what we will think, we may think that, oh, this topic may be boring, or this is not related to me, or like I'm still young, I don't think I have this problem yet, right? But in fact, have you seen the news? More and more young people are getting heart problems, heart attacks, and some pass away so suddenly. Like when the day before, they were just fine, right? So, and in this pandemic, we glued our eyes to the news of the COVID-19, but cardiovascular disease is still the number one cause of death worldwide. So let me share with you about today's topic, cardiovascular disease. So in today's society, medical science is so advanced, but many people still die from diseases such as cancer, diabetes, heart diseases. And according to the statistic by the World Health Organization, cardiovascular disease is still the leading cause of death. So an estimated of 18 million people die of cardiovascular disease each year. So it is projected that there will be more than 23 million people dying from cardiovascular disease by the year of 2030. So meaning that in every 3 people, there will be 1 dying from cardiovascular disease. Hence, to keep the deadly cardiovascular disease at bay, we should actively keep the cardiovascular system healthy. So what is cardiovascular disease? So it includes heart disease, stroke, heart failure, arrhythmia, which is irregular heartbeat. So what are the causes? So the causes are atherosclerosis, hypertension, high cholesterol, high amounts of omega-6, which causes inflammation in the blood, hence leading to atherosclerosis, increasing the risk of heart diseases and also stroke. So let's take a look at how atherosclerosis is formed. So atherosclerosis is a disease which plaque build up inside our arteries. So plaque is made up of cholesterol, fat, calcium, and also other substances in the blood. So over here, this is the plaque. Hence, unhealthy blood cholesterol levels are a major risk for atherosclerosis. So when bad cholesterol, which is the LDL, accumulates in the artery wall, T cells are activated and attack the bad cholesterol, thereby causing inflammation that leads to atherosclerosis. So to eradicate this problem, you should eat a balanced diet, control cholesterol intake to stop the inflammation in the body. So another common cardiovascular disease will be hypertension. So hypertension occurs when constant excessive blood pressure is on our artery walls. So when one's blood pressure reading is higher than 140/90, it is known as high blood pressure. So the bottom number is actually the diastolic pressure, and the top number is actually the systolic pressure. So what is the healthy range of blood pressure? So the normal range is actually 120/80. So when the diastolic pressure is less than 80 and the systolic pressure is less than 120. And hypertension actually causes T cells to accumulate in the kidneys, causing kidney dysfunction, leading to the weakening or loss of kidney ability to excrete water and sodium. Hence, hypertension is often known as the silent killer. So when one has hypertension, the doctor will actually prescribe some antihypertensive medications. So have you thought of how these medications help to lower blood pressure? So it will be through reducing our blood flow. So some drugs help to decrease the amount of blood the heart pumps each minute. So an example will be like a water pipe. We have to turn down the faucet to have the water flow smaller. And also relating back to our blood vessels, it means that the drug only helps to lower blood pressure, but the waste inside our blood vessels is still there. Hence, the drug does not solve the root cause. Another type of medication will be promoting urination, which is also diuretics. It inhibits renal tubular reabsorption of water and sodium to increase the excretion of water and sodium. This leads to the dilation of our blood vessels, hence lowering blood pressure. The third type of antihypertensive medications are to dilate our arteries by relaxing the vascular smooth muscles. This temporarily controls hypertension and reduces its symptoms. Have you heard that taking antihypertensive drugs can help to solve hypertension? So I'm sure that is a no, right? Doctors will advise patients to consume these medications for a lifetime. So why is it so? Because if we stop taking the medication today, the blood pressure will spike up, as these drugs can only alleviate symptoms but cannot treat the root cause. So let us take a look at the side effects of these drugs. So when taking these drugs, we have to be extra careful and follow doctor's instruction on how to take these medications. And these are some of the common medications, like lisinopril, to prevent blood vessels contraction, but it causes possible side effects such as persistent cough, kidney problems, dizziness, and even rashes. And the next one, digoxin, it increases the force of our heart contraction, slows irregular heartbeats, but the side effects is also irregular heartbeats, loss of appetite, nausea, and also impaired kidney function. Next, we have warfarin, blood thinner, but it can cause nose bleeding, gum bleeding, easy bruising as well. The last one, we have spironolactone, which is a diuretic. It can cause poor kidney function and also low blood pressure. Hence, all these medications can only control the symptoms, and drugs have side effects like what I explained just now. So, where we cannot avoid it as well. And it cannot help to improve the flexibility of our blood vessel walls. Hence, drugs alleviate symptoms but cannot treat the root cause. If we want to improve our cardiovascular health, we have to understand the causes of cardiovascular disease. In fact, many diseases are actually due to what we eat. So what do many of us like to eat? So many of us prefer to eat meat or seafood in our daily diet, right? So according to the American Heart Association, the recommended daily cholesterol intake should not exceed 300 mg. So let's take a look at some of the cholesterol in foods so we can choose our foods wisely. So over here, do you see any food you like over here? So personally, the first part, right, I don't eat animal innards, but let's take a look at the cholesterol in it. So like pig's brain, cow's brain, it has over 2,000 over cholesterol, which is a lot. And also kidneys in pig and cow, there's over 300, 400 plus of cholesterol. And the liver from a pig also has 368 mg of cholesterol. And also sausage is not low as well. It has over 150 mg of cholesterol. So what about seafood? So this list will be my favorite especially. So my favorite will be cod fish and also crab. So let's take a look at seafood. So for cod fish, is the lowest among the rest. It has 40 mg, prawn of 170, lobster of 85, salmon of 86, and crab of 100 mg. if I'm not wrong, 100 grams of crab, just 100 grams of crab, right, is actually less than just 1 crab, which is actually very little, but very high cholesterol. And also cuttlefish or fresh squid, 100 grams of it has 248 mg of cholesterol. Some may say that they don't like to eat meat or seafood, but they like to consume eggs and also dairy products, right? So let's take a look. So I'm sure eggs are many Singaporeans must have in their breakfast, right? So 2 a day at least. So let's take a look. An egg yolk, right? Just a chicken egg yolk has 266 mg. And also a duck egg yolk of over 600 mg of cholesterol, a quail egg yolk of 74 mg of cholesterol. And I'm sure for quail egg, right, we usually eat a few, like 4 or 5 at once. And this will definitely exceed the recommended amount of 300. So what about scrambled eggs? Scrambled egg also exceeded 435 mg. And cream also has cholesterol as well of 140 mg, 100 mg of cholesterol in cheese, and of course, ice cream. Ice cream also has cholesterol. Every 100 grams of ice cream contains 45 milligrams of ice cream. So sometimes we may eat a tub of ice cream, right? So we may need to take note of that as well. And also 100 grams of milk has 30 mg of cholesterol. So let's take a look at oils. So 100 grams of chicken lard contains 74 mg of cholesterol. Pork, have you tried pork lard? Because some may use lard to stir fry or even barbecue, like the recent very popular Thai barbecue, right? The Mukata. It's actually, they also use pork lard as well. Isn't it very fragrant? And most dishes actually uses pork lard as well. But lard has 56 mg of cholesterol in 100 grams. And 100 grams of butter has 260 mg of cholesterol, while for vegetable oil, there's 0 cholesterol. Although vegetable oil, it does not have any cholesterol, it is actually a major cause of cardiovascular disease. So we will talk about that later. So let's take a look at fast food. So do you like to eat Western food or fast food, like hamburger or fries? I'm sure this is very common and easy to find everywhere, right? A small burger actually contains 30 milligrams of cholesterol. A large double cheeseburger has 80 mg, while a fish fillet burger of 40, and even a strawberry milkshake, a small cup, only 178 grams, has 25 mg of cholesterol. So from here, we see that our diet can easily exceed the cholesterol intake daily. Hence, after looking at the chart, we should choose more healthy and also lower cholesterol foods, which can help to reduce the risk of cardiovascular diseases. So why do vegans, have you thought of why do vegans have high cholesterol, even avoiding dairy products, avoiding eggs? Shouldn't they have no cholesterol at all? So where does the cholesterol comes from? So actually 25% of the cholesterol comes from the food we eat, and 75% is produced by our liver. That is why, despite being a vegan, the cholesterol levels can still be very high. And why does our liver produces cholesterol? So let's learn more about our liver. So our liver produces 75% of cholesterol, and let's take a look at why our liver is one of the most important organs. So our liver is the largest gland in the body. It has over 500 different functions. So the main functions are to detox, filter, and cleanse our blood. If our liver malfunction, it can lead to dull skin, the spots start to show up on our skin, and also making bowel. Some people may suffer from like digestion problem, bloating. This may also be related to the malfunctioning of our liver as well. And also, it is our major fat burning organ. So if you wish to have better weight loss results, slimming results, we also need to make sure that our liver is healthy to help us to burn fat. And also regulating our blood sugar level. If our quality of sleep is not ideal, it can actually affect our liver, which in turn results in unstable blood sugar level. And also release of energy. How? So have you noticed that some people around us, some are always tired despite getting enough sleep, a lot of sleep. This is because our liver stores carbohydrates for energy. Hence, when our liver is damaged, it is not able to store carbohydrate. Hence, we must take extra care for those with such symptoms. And also synthesize hormones. When our liver is malfunctioning, it cannot produce the needed hormones for the body to function normally. For example, estrogen and androgen, which will lead to endocrine disorder. So especially in our modern society, right, many people are prone to being very tense, stressed, and many hormonal imbalances are actually linked to our liver health as well. So also making cholesterol. So from here, we can see that many health problems are related to the liver. But why does the liver need to make cholesterol? So I used to think that cholesterol is a bad thing because high cholesterol is one of the causes of cardiovascular diseases, right? And a high cholesterol requires long-term medication as well. But in actual fact, we need cholesterol because without it, we can't live. Because cholesterol is one of the most essential substances to the human body, which needs it to form cell membranes. So you can take a look at the picture on the right. So the smallest unit of a cell is actually our DNA over here. So every cell in the body contains a cell membrane, this one in pink. So cholesterol plays a very important role in forming cell membranes. In addition, cholesterol is also vital for the synthesis of hormones like I mentioned earlier. For example, the body secretes androgens and estrogens. So it needs to have sufficient cholesterol to do that. If the liver is not healthy, it may also cause endocrine system to become unbalanced. Also, we need cholesterol for the synthesis of vitamin D. So have you heard that sunlight has vitamin D? So in fact, there is actually no vitamin D in sunlight. Our body synthesizes the sunlight we are exposed to, and also together with the cholesterol in our body, they turn into vitamin D. Therefore, cholesterol is an important element in the synthesis of vitamin D. However, we must take note that when our liver produces too much cholesterol, which will increase the risk of heart disease and also stroke. So have you realized that every time we go for a medical examination, a blood test report will contain a cholesterol report? So one is the LDL, commonly known as the bad cholesterol, and the other one is the HDL, which is commonly known as the good cholesterol. So in fact, Dr. Zhao Fei Chen, which is the founder of nutritional immunology, like what Nicole has mentioned just now, said that actually our body does not have the so-called two types of cholesterol. It's actually just one. So when the liver produces cholesterol, we will transport the cholesterol to the cells in need of the body. And it is called low density lipoprotein, the LDL. So it's like a seller calling out to who needs cholesterol, and that is when the cell membranes and the hormones will take in the cholesterol needed. So when there is excess LDL, it will directly deposit into our blood. Over here, like the picture, is just depositing the leftover into our blood vessels, forming plaque. And it accumulates over time, it will cause atherosclerosis, causing severe blood vessel blockage, leading to stroke and heart attack. So the higher the LDL, the worse it is for our body, which is why we call it the bad cholesterol. So if our liver is healthy, it will produce enough high-density lipoprotein, which is the good cholesterol. So when we take a look at the picture, its function is to collect. So it's collecting the LDL in the blood back to our liver where it is broken down. So it can also remove cholesterol from our artery walls. So the higher the HDL, the better for our body, which is why we call it the good cholesterol. So we mentioned about our diet earlier, which will not affect our cholesterol, but also our liver. So if the liver is unhealthy, it will produce too much cholesterol. So the health of our liver is actually directly affecting the functioning of our heart. So when the liver is unhealthy, it will produce too much cholesterol, the LDL, resulting in atherosclerosis. This in turn affects the heart function. Moreover, liver does not have any nerve ending, meaning we can't feel pain when it is being damaged. Hence, we must take good care of the liver. So earlier on, I've mentioned that vegetable oil does not contain cholesterol, right? In fact, vegetable oil has adverse impact on our health. But why do we talk about oil? Well, in fact, fat is the basic nutrients required by the body, where it is divided into omega-6 and omega-3. The Vegetarian Society of the United Kingdom Limited recommends an omega-6 to omega-3 ratio of 3:1 in one's diet. So high amounts of omega-3 help to reduce the risk of cardiovascular disease, whereas high amounts of omega-6 cause inflammation in the body and increase the risk of cardiovascular disease and stroke. However, modern diets contain too much omega-6 and too little omega-3. So the typical American diet tends to contain 14 to 25 times more omega-6 than omega-3. So a question over here, do we usually cook our meals, or do we eat out more or having takeaway more? If it is the latter, eating takeaway more, eating out more, then it is very difficult to control the choice of oil being used. And nowadays, people like to eat fried food, fast food, as it is very convenient, right? Hence, the ideal ratio of omega-6 to omega-3 fatty acids in the diet should be 1:1 and 4:1. So let's take a look at what types of oil people use at home. So does anyone use grapeseed oil? Many people have heard that grapeseed contains OPC, which is very rich in antioxidants, but when it becomes grapeseed oil, it is no longer good for the body. The ratio between omega-6 to omega-3 in grapeseed oil is actually 676:1, which is very, very high. And cottonseed oil of 259:1, and sesame oil, which is also an essential during confinement. So sometimes after confinement, some people may feel the whole body is aching, as the omega-6 content is very high, causing inflammation in the body. So of 137:1, and corn oil and palm oil of 46:1, and also very commonly used for cooking a sunflower oil, 39:1. So let's take a look at the next table. So peanut oil of 32:0. So for peanut oil, there's 0 omega-3 in it. And TC oil of 32:1. And many people use olive oil, right? For maybe pasta, spaghetti. So the ratio is also quite high of 13:1. And soybean oil of 7:1. Canola oil 2:1. Macadamia oil of 1:1. Perilla oil, seed oil, and kiwi fruit oil of 1:4, which the omega-3 is higher. So now we know that the oil we eat every day increases the risk of cardiovascular disease. And it's no wonder that cardiovascular disease is the #1 killer. So in addition to the causes of cardiovascular disease I mentioned earlier, like atherosclerosis, hypertension, high cholesterol, and also excessive omega-6 fatty acids. So what other factors can cause cardiovascular disease? So let's take a look. So it includes malfunctioning immune system, aging, but why aging, right? Because when we age, we lose collagen. So the blood vessels also lose their elasticity and also flexibility. And also unhealthy lifestyle like alcohol drinking, smoking, our emotions like anxiety, stress, and also staying up late. Also unhealthy dietary habits like eating a lot of fried oily food, lack of fruits and vegetables, and such unhealthy dietary habits in the long run is one of the main causes of obesity and leading to cardiovascular disease. So besides adjusting our lifestyle, what nutrients can we take to prevent the cardiovascular disease? So let me share with you some superfoods that can help to boost the immune system. So we have blueberries, very rich in antioxidants to reduce buildup of the bad cholesterol, prevent formation of blood clots, lessen the burden on our liver, and also lowering blood pressure, therefore preventing cardiovascular disease and stroke. Next, we have hawthorn. Hawthorn keeps our cholesterol in check, protecting against atherosclerosis, maintaining smooth blood flow, regulating blood pressure, improve our heart function. And also oriental raisin tree. Not sure if have you all heard before. This fruit is actually very popular in Korea. It helps to nourish our liver cell regeneration, strengthen liver function, lowering blood pressure and blood lipids level, also maintaining cardiovascular health. Next, we have American ginseng. American ginseng helps to prevent LDL oxidation, prevent atherosclerosis, promote liver regeneration, inhibit growth of cancer cells, and also balancing our immune system. Next, we have cactus. Cactus is known as the king of plants, it contains more than 10,000 types of phytochemical to boost our immune system quickly, and also anti-inflammatory properties to aid in wound healing, prevent atherosclerosis, and accelerate the tissue's regeneration. It helps to lower cholesterol and triglycerides, lowering the LDL, the bad cholesterol. And also rose. Rose actually is very, very rich in antioxidants. It has antioxidant 50 times more than lemon. It helps to fight free radicals, delay aging, and I'm sure many's favorite, enhance our collagen production, which can actually help to improve our blood vessels elasticity, preventing our blood vessels from rupturing, and also improving our blood circulation. Next, we have cordyceps mycelium. Cordyceps mycelium can help to prevent atherosclerosis, stroke, and heart disease, strengthening our internal organs, our heart, our lung, our kidney function, and also raising our HDL, the good cholesterol, and reducing the LDL, the bad cholesterol. So clinical research has shown that 273 patients took cordyceps mycelium 3 times a day. After 8 weeks, patients enjoyed average of 17% decrease in cholesterol levels. And a clinical trial in Guangzhou Medical College, 38 elderly patients took daily for 3 months, and 20 of the 24 patients with supraventricular arrhythmia, which is a form of irregular heartbeat, exhibited signs of recovery. So far, I have spoken about the superfoods to nourish the liver, to avoid the overproduction of cholesterol and clear the cholesterol in the blood vessels. So you may think that, that it can reduce the risk of heart disease and stroke, isn't it? So there is actually one more place to check, which is our gastrointestinal tract. So what should we do? So earlier on, I mentioned that there are a lot of foods that contain cholesterol, and it is impossible to avoid them, as everyone still wants to eat some eggs, right, or meats. So what can we do? So we can consume plant foods that are rich in phytosterols, as it can speed up the excretion of cholesterol from our body. So the pink here is actually the pink color here is actually our intestines, and the yellow one is the cholesterol we consume from our food. So after eating, the cholesterol will be in our intestine, where after that will be absorbed into our bloodstream over here. So what happens if we consume phytosterols? So phytosterols will compete with cholesterol, which is the green one, phytosterols, to be incorporated with the mixed micelles, which is the over here in green. So phytosterols have a greater affinity for micelles than cholesterol, causing cholesterol to be excluded out of the absorption process. So the cholesterol is unable to be absorbed by our body, hence will be excreted out of our body. So in this way, phytosterols speed up excretion of cholesterol from the body. The research shows that consuming 2.2 phytosterols can reduce cholesterol absorption of 60% in a day. So let's take a look at plant foods that are rich in phytosterols. So we have soy here. So actually 1 gram of soybean contains 0.843 mg of phytosterols, which has the effect of lowering cholesterol. So consuming phytosterols can reduce the cholesterol content in the body by 10% and also LDL content by 15%. And research shows that consuming 1.5 gram to 1.8 gram of phytosterols a day can reduce cholesterol absorption by 30% to 40%, while an intake of 2.2 gram of phytosterols per day can reduce the cholesterol absorption by 60%. Actually, I did the calculations earlier. With soy, right, we have to consume 2.6 kg of soybeans to get 2.2 grams of phytosterols a day. And that is a lot, which is we have to consume over 2 kg of soybean every day. And from this data, you will realize that it is very difficult to rely on just phytosterols to prevent the absorption of cholesterol. But why do we still mention about soy then? Actually, many people drink milk, take eggs or meat for protein, right? However, they also contain fats, cholesterol, and also cancer-causing hormones. And on the other hand, soy is cholesterol-free, and its protein level is 2 times higher than meat, 3 times higher than egg, 12 times higher than milk. And it can help to lower the bad cholesterol and also raising the good cholesterol. So it is recommended to consume soy for protein, and it can prevent the risk of cardiovascular disease. So the other plant food that is rich in phytosterols is actually dietary fiber. So besides helping to lose weight and preventing constipation, it can also help to lower cholesterol. There are 2 types of fiber, insoluble and soluble. Insoluble fiber acts like a natural cleanser, like a broom. So where it helps to excrete toxins from the intestines, keeping the intestines clean. While soluble fiber protects the intestines with a protective layer, so it can prevent the absorption of cardiovascular disease. So which plant is rich in fiber? So let's take a look. So it is psyllium husk. So 71 grams of soluble fiber is in 100 grams of psyllium husk, preventing the absorption, the body from absorbing cholesterol and fats in the diet, thereby helping us to reduce cholesterol and also lowering the risk of heart disease. So if we want to live a healthy and long life, we must prevent the world's #1 killer, which is cardiovascular disease. As long as we can prevent cardiovascular disease, we can live to at least 100 years old. So how to do it? So practice the way to health and longevity. So to have a healthy body, we have to start from an early age. Firstly, we have to have sufficient rest and sleep, at least 6 to 8 hours a day. So I'm sure many of us can do that, right? And also next will be moderate exercise. So it helps to strengthen our heart, our lung function, preventing coronary heart disease, increasing flexibility of the body and our joints, enhance vitality, and also promoting lymphatic circulation. So if we really don't have time to do exercise, we can go for a slow walk or even brisk walk, or maybe you can give a goal for yourself of hitting 10,000 steps a day, or even deep breathing exercise also works as well. And also staying positive and happy. So when we are unhappy and feel stressed, our body will secrete corticosteroids, which will suppress the immune system. So together with a balanced nutrition by eating more vegetables and less meat. So I hope that through my sharing, we will work together to stay away from the world's #1 killer, cardiovascular disease. So for friends who are currently taking medication for their cardiovascular conditions, do practice these 4 ways for health and longevity. So in the near future, I'm sure that the medication can be reduced or even stopped, of course, with the doctor's advice as well. So I wish everyone good health, stay home and stay safe. Thank you.
Okay, thank you, John, for your sharing and clear explanation. I believe that through Jan's sharing, we truly understand that taking cardiovascular medicines will never lead us to the destination that we always dream of. While proper nutrition that are made specifically for our immune system are able to nourish and strengthen our cells and organs, eventually create the desired result in the long run. Now, I guess everyone here, including me, would like to know whether there are people who truly benefits from nutritional immunology. Am I right? Yes, tonight we have a beneficiary will share with us a successful story in gaining back health through nutritional immunology. Now, let's welcome our friend Xiaoling.
Thank you, MC. Good evening, everyone. I'm Xiaoling. I would like to share my testimony on how I gained back my health due to fatty liver and sweaty palms. Normally, I love to eat unhealthy food like fried food, laksa, curry, and a lot of meat because it's tastier. I also drink a lot of yogurt drink. I went for a full body medical checkup on 8th of March 2018. Let me show the medical reports result. The result showing that my GGT was 93, which for female, normal range 9 to 36, and AST was 41, which normal range 5 to 34. With such result from this medical report, likely related to fatty liver, which means that I have fatty liver. I was shocked that I have fatty liver after getting to know the result and wonder how to overcome such a health problem. I also have no idea how long I had fatty liver till medical checkup 3 years ago. But I do have sweaty palms for years. Along the journey, I felt easily tired and uncomfortable. At first, I didn't think of seeing a doctor to solve such a problem. As I recall that I had chance to get to know nutritional immunology through my upline previously. I informed my upline about my health situation and she guided me through nutritional immunology products to assist me on that. From then on, I consume 1 packet of soy green together with 1 packet of berry beet as my breakfast in the morning. I also consume 1 packet of raisin tree in the afternoon. I have been consuming the products for 3 years. And I currently still consuming soy green, immunity, rosy thyme, raisin tree, fiber talk, and phytofat. I went for a full body medical checkup again on 31st of March this year. Let me show the medical reports result. The results show that my GGT was 31, which is in the normal range, and AST was 21, which also in a normal range, which means that I don't have fatty liver anymore. My sweaty palm also reduced. I'm so glad that I gained back my health through nutritional immunology products. I would like to thank Dr. Cheng for inventing such a wonderful products that assist me to gain back my health. Thanks everyone for listening.
Okay, thank you, Xiaoling, for your sharing, and congratulations to Xiaoling for becoming healthier and happier. Every one of us should not underestimate the severity of fatty liver, as in some cases it can cause inflammation to the liver and lead to liver damage. Here we have a disclaimer. Okay, every product is specially formulated to nourish the overall body, including our immune system. However, our products are not in any way a form of medication or drug and should not be used to treat or cure illnesses. Okay, now let us proceed to the next session, our Q&A session. Okay, now you may unmute your mic to ask a question, but due to time limitation, we can only answer 1 question. Let's say if your questions were not chosen, you may consult your friend who invited you to this webinar. And at the same time, let me have a quick check on the chat box and see if any one of you has entered the question here. Okay, so one of our friends asked, many people ask me, elite products are very sweet. Can diabetic patients consume it? Okay, may I know, is there anyone from Q&A committee are willing to answer our friend's question?
Hi, MC. I'm Aina. I can help to answer this question.
Okay, thank you, Aina.
Okay, I also have our friends asking the same questions before. Nowadays, many people are very conscious and they will choose the low sugar drinks. In Singapore, our government also encourage us to eat healthier, to have less oil, less salt and sugar. And many people think that diabetes patient cannot eat sweet stuff. In fact, when we eat food, part of the food will be converted into glucose and become energy so that we can survive. And doctor will also advise diabetes patients not to eat so much white rice and suggest them to eat brown rice. So is white rice sweet? They are not. But why do doctors recommend brown rice? The reason is very simple. There are more fibers in the brown rice, and when it is converted into glucose, it is relatively slow. Therefore, the glycemic index, GI, is lower. I have some data over here, and let me share with you. So as you can see over here, for white rice, the GI is 88, brown rice 59, glutinous rice 87, miso noodle 68, steamed bread 88, baguette 95, white bread 71, whole grain bread 50, and multi-grain bread which is 48. So for diabetes patients, what they need to pay attention to is the GI of the food and not how sweet is the food taste like. Diabetes patients should choose food with a low GI. As asked in the questions that elite products are very sweet, let's take a look on the following slide. GI mainly reflect the speed of blood sugar increase in our body. For example, glucose have a GI of 100 and the GI will soar immediately after we consume it. Sugar in food can be divided into many types. For example, like sucrose has a GI of 66. It is extracted from sugarcane and usually it is made into white, brown or raw sugar. Fructose has a very low GI of 23. The GI of honey is 62. The GI of monk fruits and stevia is 0. Coke in many countries is using stevia instead of a white sugar. Stevia is 400 times sweeter than white sugar, but its GI is only 0. So many diabetes patients are using artificial sweetener, which have no calorie for sugar. However, it can harm our health and even cause side effects. The American Diabetes Associations believe that fructose has a very small effect on blood sugar than the sucrose, and it is okay to consume in a very small manner. When developing elite product, Dr. Zhao Fei Chen not only emphasized the nutritional value, but also emphasized greatly on the taste of the products. Let's take a look on what type of sugars is being used in this elite product. Some friends find that Rhapsody and Rosy Tom are very sweet because they are very sensitive to the sweetness, and usually they don't have this sweet stuff in their diet, especially for the diabetes patient. The sweetness of Rhapsody and Rosy Tom come from the ingredients of fructose. A small amount of fructose is being added to the product. So for the berry beets, phytophyt and soy green, the sweetness of these three powder form products come from its own ingredient and a small amount of fructose that is being added in. Firstly, let's take a look at the complete soy food. The American Diabetes Association has also recommends diabetes patients to eat more soybeans as a source of a protein intake. because our soybeans have a very low GI around 10 to 23, which can help in stabilizing the blood sugars levels. Besides, soy is plant-based that is rich in protein and it will not burden the kidney. It also can reduce the risk of our kidney damage. Speaking of soy, do you know what kind of a sugar was being added into the soy drinks in the market? For example, the packet soy milk or homemade soy milk. Usually to make the drink to be more tastier, substitute sugars or brown sugars is being added and they have a high GI. Have you ever drank unsweetened milk before? Does it taste nice? So do you think that our phytofit and soy greens taste good? Thanks to Dr. Zhao Fei Chen for making all these soy drinks to taste so good. Even the children also love them and they can be used by the diabetes patient too. So these two products, Raising Tree and Soy Pro, do not contain any fructose. Then why is Raising Tree still so sweet? In fact, the sweetness of monk fruits is 300 times sweeter than the white sugar. But monk fruits have zero GI. If some diabetes patients are very conscious of having sweetness in their food, they can choose Soy Pro because it has no fructose added into it. The main ingredients are soybeans and chili ginseng. This research done by Dr. Zhao Fei Chen on nutritional immunology is to prevent us from diseases such as diabetes, which is the number 6 killer in the world. Data has also shown that in Singapore, there is 1 out of 9 Singaporeans have diabetes. So back to the questions being asked, whether diabetes patients can consume elite products. The answer is yes, and diabetes patients should choose elite products. Thank you.
Okay, thank you, Aina, for your excellent answer. And I guess many of us, including me, used to think that sweet foods contain a lot of sugar that will increase our blood sugar level. Actually, it's not. Just like what Aina has told us, glycemic index is actually so-called the truth behind blood sugar level. Since elite products, sweetness are from fructose, which has a very low glycemic index. Therefore, elite products are totally safe for diabetic patients. Okay, once again, thanks Anna for answering the myth behind sweet foods. And just now I noticed that one of our friends asked one more question. The question is, what is the normal rate of our HDL and LDL? So the answer from our Q&A committee is that HDL is more than 40 milligram per deciliter, and our LDL must less than 130 milligram per deciliter. And yeah, if no more question, then I will proceed to the next session. Okay.